Thank you, Dr. Deepamala and Sahani sir. And good evening, good afternoon, and good morning. This is the 1475th day of continuous webinar conducted by International Forum for Promoting Homeopathy. We welcome all to this session, and today our guest is Dr. Yamini Remesh from. Let us begin the session with silent prayer. Thank you all. As you all know, the International Forum for Promoting Homeopathy comprises of well-wishers of homeopathy, homeopathy students, and doctors. And we have 3 sessions every day. The first session is already over. That's our Hindi session from 7:30 to 8:30 and 8:30 to 9:30, the international session in English, and from 9:30 to 10:30, a local language session in Malayalam. All these sessions are going in a good way, and we are uploading our videos the very next day itself, so that those who miss this can watch again and again. By you can search it at IFPH Homeopathy. Let me introduce the guest of the day. As you know, it is Dr. Yamini Remesh. She has completed BHMS, CCAH, and FCAH. And she is the consultant homeopath and co-founder Asha Homeopathic Clinic Academy and Homeopathic Junction. Dr. Yamini Remesh has been practicing homeopathy since 2008 at Asha Homeopathic Health Center in Indore, specializing in treating hormonal disorders, women's health, children's health, and joint disorders with notable success. Her extensive training under renowned homeopaths like Dr. Rajesh Shankaran, Dr. Sarkar, Dr. Jay Shah has enabled her to integrate a variety of tools and techniques into the holistic practice, and she has also a deep interest in pediatric and psychiatric cases also. As a co-founder of Asha Homeopathic Academy, Dr. Yamini is dedicated to educating the next generation of homeopaths. She regularly teaches advanced methodologies and has developed several innovative courses such as e-clinic setup program and the clinical course on therapeutics. She has been launched the foundation course specifically designed for the beginners of homeopathy. Dr. Yamini is committed to education, extending program, organizing medications and counseling workshops, and both patients as well as doctors, and often collaboration with her husband, Dr. Vallabh Jain. Her effort in homeopathy has been recognized with the prestigious Lipi Award from Burma Arogya Trust in 2014, and she has been also established a rare medical bank and community library dedicated to homeopaths at her clinic. She has done national as well as international presentations. She has won several awards, and she is working for. She organized medical camps for children, women, elderly, and marginalized communities through her philanthropic organization, Abhijit Foundation. So she is a person who is fully dedicated to promote homeopathy among public as well as any other medias. She is a very active person at social media also. So let us proud, as you know, today's discussion will be the secret of mammal remedies in homeopathy. As you know, that there are a different set of medicines being prepared from different things, and today Dr. will be discussing about this subject, secret of mammal remedies in homeopathy. We proudly welcome the guest of the day, Dr. Yamini Remesh. Welcome, Doctor.
Thank you so much. Sir, am I audible?
Yes, yes, yes.
So thank you so much for the introduction, and I'm feeling privileged to come here. Thank you. Special thanks to Dr. Dhanesh sir for giving me this platform and the entire community of IFPH. All of you are doing a great job by promoting homeopathy, and I'm really glad to be part of this. So let's start today's session. Sir, is my
Yes,
screen up, like
yes,
visible?
it's visible. It's visible.
Okay, great.
And audible. Everything fine. Just
So first of all, I would like to present two cases which I have solved with mammal remedies, because I believe that practical application of anything is best seen when we discuss cases, and then we can understand the themes or the symptoms of that group. Because if we are talking about mammal, this is a group from an animal class which we use in homeopathy. We have a lot of remedies. Many of our senior homeopaths colleagues are here. They must be using the remedies from mammalia class. So we will be talking about themes and how I use mammal remedies in my practice and how they are useful. But first of all, I want to tell you that I want to show you two cases where I have got very good success and very beautiful cases, just solved just because of the lack remedies. Yeah. Okay, so this is a case one, and this is a female of 28 years old. She's an NGO worker and accountant by profession, unmarried. She came to me for chronic depression with a lot of pain in arms along with chronic asthma. So she had depression, this body ache, which was horrible, and along with that, she had chronic asthma also. But this asthma thing I got to know later. So I'll tell you what was the patient's version. So she said initially that, doctor, I don't have any interest in anything, just like the common depression symptom, that no interest in doing anything. I feel like doing nothing, though I do all my household chores regularly. But if you ask me, I'm not interested. In Hindi, she said, ऐसे ही बिना interest के काम कर रही हूँ. So without interest, I'm just doing this thing. I have tremendous pain in my arms and hands, and it comes very often. And she was on painkillers. So she said, if I take painkiller medicine, which relieves the pain, within 2, 3 days, it comes back. And I'm experiencing this pain since 3 years. So this pain started before everything. And this was going on for almost 3 years. Every week, I have to see the doctors, take the painkillers. There's no way out. So almost every week she was visiting some, MD physician, orthopedic surgeon. Too much of pain, no cause, nothing they could find, and they said it is because of psychological aspect, and you go to a psychiatrist, and the psychiatrist gave some medicine, something like that happened. And then she started narrating her complaints. She said, doctor, I have a lot of things to do in my household. I have two siblings, one mom. My uncle also stays with us. I'm working in an office. She doesn't have a father. I have a lot of financial worries because my family is dependent on me. I am the only person earning, and we are all middle class people, so I am looking after the whole family, from groceries to clothes, everything in household I am just managing. So I can't leave my office and just rest and go to doctors every time. Please do something. She said, my mom is a very simple lady. She has never gone to market. She's not educated, never interacted with anybody outside. And now my father has expired. So I have to take care of both the siblings. They are younger to me. They're studying, one in school, one in college. So I asked, okay, tell me more about yourself. So she said, I don't feel like doing anything, doctor. I'm doing routine things, but that is also burden for me. And I don't feel connected to anything anymore. There are only 2, 3 friends in my life whom I love to talk, and I can talk to them for hours. I will call them, talk to them. Baki sab to, that's okay. Or other people don't ask me anything. So I said, okay, tell me about your complaints. She said, I feel depressed, no interest in anything. I miss my father a lot. If he would have been here, I would have been more happier, I feel. Second thing in my house is I'm handling all the responsibilities, and still people don't understand me. I just don't feel happy from inside. And this family is also torturing her by asking different things, because the siblings are younger, mother doesn't understand anything, the uncle was dependent on her. My brother fights with the younger sister. He left school from last 6 months. The principal called me, scolded me. So she had a lot of, these family problems. And when I asked him, she said, when I asked the brother why he didn't go to the school, he said, I just don't like it. He's very rebellious. He hits the younger sister, fights with my mom. I'm in the office most of the time. So from office only, I have to manage all these things. I come home in the night. I don't stay at home, so don't know exactly what these people do all day long. So there are many problems in my house also. I get very disturbed by this thought that how will I survive in future? What will happen? And then she told me that, doctor, I forgot to tell you that I have asthma also. And she takes some homeopathic medicine from some other doctor on and off. And she said it is better, but whenever it comes, it is an acute violent episode mostly, which happens in night, and someone from my surrounding, some neighbor or some friend just takes me to the hospital. I get all those pumps and inhalers in my system, and this is also happening from last 2 3 years. So all the problems started almost 3 years back, basically when she lost her father, and all the responsibilities came on her shoulders. So she said, I have problem in breathing since childhood, but these days I'm going to hospitals every month, I guess. My father and grandma also had breathing issues. But this pain in arms, it's so annoying. I feel my guzarne wala. So the whole life is going to be with my family members taking their responsibilities. I don't have my own life, she said. So then I asked her, what is your experience inside about this whole situation? She said, I feel my life is going like this and I don't want to be like this. I feel no one loves me. I'm just kind of useful person for them. So they take my advantage, whether it is my family members or my friends. They would call me and they would tell me that you have to do this. I do that. And that's all. So just, I'm not a loved person, but I'm a useful one for them. So this is my problem. I feel used, and I'm not complaining about it. She said, I'm not complaining that they use me, but sometimes I really feel sad that people are so selfish. There are only two friends of mine. So she has only two friends whom she can call. And she said that they call me without motive, without purpose. Otherwise, everyone calls me for their work. And second thing is, I'm just a worker. For most of people, they would just dedicate something to me and I would finish that responsibility. And then they don't ask me or call me that how am I, etc. I do my friends recharge, bill payments. So she's the girl who's a very workaholic person. She takes care of other people. Other people gives lot of responsibilities to her, but nobody is her true friend. So this was, bothering her. Whole day I do all these things, but inside I feel sad for myself. I feel angry also at times. I feel जैसे लोग फायदा उठा रहे, people are taking advantage of mine. These people are so harsh with me, and they just give me lot of work. And in Hindi there's a word called gadha mazuri, gadha hamali, like lot of donkey work which we say. So she said, I feel I'm a burden to everyone, doctor. Though I do a lot of work, but still I'm not able to lift up myself. My body is aching. I have asthma and all those things. So then I asked her, what is your experience? And she said, of this, being burdensome, not important, people are harsh with you. I really feel that my family is bearing with me because I'm useful. If I don't earn or don't do anything tomorrow, they would just kick me out. Same thing I feel with the office and other people, that I'm a burden for them. Why would they tolerate me? They don't even remember me as if I don't exist. So she feels that she's a useful person. That's why she's kept in the house. That's why people are calling her. But she is a burden for them. And for work also, she feels that the work is burdensome. And she's just, doing it for the sake of doing, but not really interested in that. So you can see a theme, a pattern here, that this being burdensome or feeling of being a burden on others is there. Okay. And then she says, doctor, I feel the same inside me also, that I'm also doing everything just for the sake of doing. I'm not interested in anything, any household duties, office work, calling people, but I have to do it for the sake of living. Though I don't take relationship with people just for my personal benefit, that's not me. I'm not selfish, I'm people's person. I like company of good friends. I'm a simple person. I don't do anything with hidden motive, which people do. But I don't belong to that class. But inside I feel frustrated. Still one part says that, we are on this earth as a community. We have to help each other. I'm a helping one. So I do most of the things because this is my nature. I cannot say no. Though I feel burdened that, okay, you're giving me, a number of things to do, I will do that. Because she's the person who, believes in helping people and doing their work. So she's a very, I would say, benevolent and supportive girl. No one forces me to do something. I do it myself. And then I feel angry that I'm not able to say no. And like this, my life is just going on. This is my problem, doctor. Please help me calm down my mind. I have so many thoughts. I have too much of thinking about future, about my health, about people. And she's very much concerned about her mother. She said, I can't get married because I don't have a father. Brother won't take care of my mother. My sister is very, yeah, like small. She's younger to me. So I have to be with my mother. And my brother is extremely responsible. He steals money from my mom. My mom is very biased about her son. She helps him bathing while he's 15 years old. So she said, I just fear that what will happen. So I said, what is your fear? So she said, fear of being abandoned, being lonely. I can't stay lonely. I need people. If I stay alone for even one day, I get breathing issues. I have to have people. I always keep myself surrounded by people. But inside, I know that I don't have anybody. So inside, she is very lonely, and she knows that, in future also, she might not get married because of the family situations. But she has a lot of anxiety about being lonely and not being able to, have somebody. She also has a fear that if I don't do jobs, if she doesn't do job, if she's not strong enough to pull off the load, what will happen? I know I'm capable enough, but due to health issues, my strength is decreasing. So the bigger anxiety is that I have health issues, breathing issues, pains, my work capacity I'm losing, and I don't want to fail. Otherwise, I'll be worthless. So feeling of worthless is there. So I asked her, what is worthless? No strength and fear of not being able to pull off the job. I have chosen the words which patient has used and then asked her that, she should explain it. That is what we do in case taking. We never put our own words into patient's mouth, but we understand what they are speaking and what is the meaning of that. So when I asked her about her fears, she said, I'm worthless. I feel one day people might feel that I'm not important, I'm not worthy. And this I have felt many times. Many people find me stupid and worthless. I don't feel appreciated. Though I do a lot of work for everyone, I even do these things in office which are not assigned to me. I'm an accountant, she's an accountant in NGO. But she's okay to pay for someone's recharge. She would do, go and pay the bills. She would do things which are not assigned to her, which is not her duties, because she believes that, okay, even if it is beyond my tasks, it's okay to help people. But she feels that these people don't respect her, never appreciates. But I don't argue with people generally. I'm a calm person, but I have these emotions inside and no strength. So she said, I feel that I'm doing many things, always multitasking, carrying this load of running a family and lot more. So people need me right now. Later, I might lose my strength to do many things. This I have felt often when I fall sick. So whenever she's admitted in the hospital, she's like, okay, I'm not able to do it. My strength is not there. She has a lot of heaviness on the chest, breathing difficulty, and strangely in the mind, she said, also I feel if I don't get better, if I will have to stay in the hospital, and if I am not useful for people, why would my family will bear with me? They will kick me out. So I'm just worthless. There's no strength. So strength is very, very important here. This thought just haunts me, saddens me. And that's the main reason, doctor, I want to get better. I don't want to be burden for anybody. Don't want to lose my family, my work, whatever life I have. I want to live stronger for my people, for my family. I want simple life, no big dream. My routine should go on with average health. That's all. I want to support my family forever. I really want to avoid conflicts. People take my advantage many times. They bully me. Still, I try to avoid. I don't go and fight with them. So I asked her about her dreams, and she said, I have seen many times that I'm in the dream. She's not able to solve a math sum in the class, and people are bullying her. So, this dream of not being able to solve a math sum, and people are calling her stupid. She's not able to solve very easy math problem. And she said, I get many dreams. And in dreams also, I'm running all the time. I'm just running. My legs are very painful. They are tired. And in childhood also, I used to have this dream that all the students are sitting on benches in the school, and my teacher told me to sit on the ground. This is a very strange dream she had. She said, I felt extremely humiliated because I'm sitting on the ground and other people are sitting on the benches. That was very unusual, but this dream was very common in childhood. And in the dream, I asked her experience. So she said, I was a very low confident person since childhood. Same in the dream, I just felt inferior that, मैं उनसे कम हूँ. That's why madam was behaving like that. I felt completely stupid. Then she said, Doctor, one thing I realized that I feel burdened. I mean, worthless, totally neglected. Also, before menses, she had pain in the breast and physical complaints, tenderness in the breast, and my periods have become little irregular since a year. And she had profuse sweating issue, lot of sweating. So she said, can you do something about it? I said, okay, we'll try to reduce the sweating. And she had the sister with her, attendant. So I always try to take some symptoms from the attendant also, because that completes the picture of the patient. So sister said, doctor, she is extremely hardworking. She takes care of everything day and night. She's ready to do everything. Even if you call her at 2 a.m., 3 a.m. in the middle of the night, she would go and help people. We always tell her not to do such things, but she never listens to anyone. In that way, she is very stubborn. Even in eating also, she is very stubborn. Otherwise, she's very good, but in eating, she's very, very peculiar, very picky eater. So if I tell her that okay, we have made a khichdi or something, she said no, I don't want to eat, and she won't eat it. So she has some choice in eating. You please do something about her problems. We are very worried. So sister was younger, but she was also very worried about the girl. And she said she's man of our house. She handles everything, a lot of strength, dedication. Since the father passed away, she's becoming very ill frequently. And she's doing job preparing for government exams, and these health problems are just disturbing for them. So this is our case. So with my analysis, we know that the patient has depression, asthma, no desire to do anything, pain in the arms. All problems started almost 3 years back after the death of the father. Chief complaint is lack of interest in anything. Asthma attacks are happening almost every month with common symptoms: chest heaviness, breathing difficulty, dyspnea, more at night, and every asthma attacks happens in the night. And hands and arms are paining too much without any physical cause. The patient is very talkative. You might have seen that this is the entire case which I have narrated you. I just asked her, tell me more, tell me about your experience, and tell me about your dreams. And she just, told everything. So she's very, very communicative. So this is my observation, that the patient is very talkative. And how's her nature? Very hardworking, can't say no to anyone, helps everyone. And she feels that she is being used by people. So she has suffered wrong. We can take this rubric. Suffered wrong. People are taking advantage. And she has silent brooding, but no visible anger. You can see that she doesn't fight with people, go and have an open conversation. She doesn't do that. She just, inside, she feels sad. She avoids conflicts, so she is not a confronting one, goes and confronts. She loves family. because doing everything for the sake of the family, supports family, very responsible. We see the theme of independent and dependent. She is dependent on the family for their company, for other things. And, by her nature, she's very independent, able to, pull off all the loads. But at the same time, she feels that I don't want to be lonely. So, independent versus dependence. Feeling of being stupid and bullied in childhood. This is a very strong theme of the remedy which we are going to give her. Feeling of being stupid. So we have seen this in dream. She feels that the teacher is asking her to sit on the ground and other people are, superior to her. So she feels inferior. So feeling of being stupid, bullied in childhood and in dream also. Fear of being lonely, very, very important fear. And delusion, she is worthless. I mean, imagine she is able to take care of the family of how many? Three, four people, and the whole office and a lot of friends are dependent on her, but she still feels she is worthless, wants communication because she can talk to the friends for hours together. So she needs some sort of communication, worried about future and family. Pain in the breast before menses, this is very, very strong symptom of mammal group, because mammal have mammies, right? So you will have problems related to mammals. That's why we have tenderness in the breast in many lac remedies. You will see this is a very common theme in mammal remedies. Problems with the family. See, mammal is one group which loves to be with the group. It has a group feeling. They are not solo creatures. Even if you see larger mammals like lions. So lion also lives in a small group. They at least have a mother and child relationship. Two people are also a group. So that's why problems with the family and love towards family. What is the problem of human? All the problem starts with the family, ends with the family. So mom, brother, sister. In this case, also you see a lot of family issues. Profuse perspiration was her characteristic. Feeling of being useless. Deep sadness and grief about father and family situation. She was very, very close to the father and grandmother. Loves talking to friends, feeling of burden for family and society. So burdensome is also a main experience of this whole case. In Hindi, she said, "कोई चीज का बोझा जैसे उठाते," as if I'm, pulling off the load. A feeling of not being strong enough, can't pull off the job assigned, feeling of being not appreciated. She said, I do everything. People don't even ask me how I am, what has happened. They would just call me, tell me, okay, do my recharge, I do it, and they're gone. They're just missing from the thing. And next time they have some work, they'll again call me. So not being appreciated, multitasking, stubborn about eating, very choosy, but choosy, not choosy about other things, choosy about eating only. Fairly intelligent girl, very intelligent. If you talk to her, you understand that she's not as dumb. She feels stupid, but she's not stupid. Dreams of looked down upon. She has to sit on the grounds and not able to solve the maths problem. And people are bullying. Again, in the dream also, she feels that she's bullied. So that's why, this constant comparison that people are doing this and I am feeling this is a theme of animal kingdom. So whenever there is me versus you, whenever there is issue outside of you, not you, whenever there is, a lot of introspection and person says that, oh, there's something lacking inside me. It is only about myself. Then the problem is in mineral kingdom. But whenever issue is outside, it can be either animal or plant. In plant, it is sensitivity, and in animal, it is more of a people are doing this to me. This is because of the situation or because of my family, my friends, my mother-in-law, my brother, whatever it is. So me versus others or me versus you. It is very evident in the whole picture that her issue is outside, that people are not appreciating me. People think I'm stupid. People are not calling me just to ask me how are you. So that's why I took animal kingdom as a theme of this whole case, because that is very, very evident. And then the question arises, which sub kingdom in the animalia? So in animals, we have majorly 6, 7 sub kingdoms, like insects are there, spiders are there, reptiles are there, mammals, birds are there. So in mammals, we see a lot of family, group issues. Um, they have, communication issues. So either they want communication or communication related issues. So that's why we chose mammals, because and the tenderness of the breast is there. So we will see why mammals. I will show you at the end. So I, at the end of the case, I always write down a remedy statement. I call it a remedy statement, that what kind of remedy I need for this particular case. So here we needed a remedy which is very strong, benevolent, very helpful, able to manage many things, multitasking, carry load, feels suffered and somewhat abused also, and still feels worthless or stupid. So if you just, without homeopathic knowledge also, if we think about different mammals, you will see we have a beautiful mammal which is extremely useful for human population, for this whole earth, which carries a lot of load, on their back, and they do a lot of work. But people think that they are stupid. They are actually not. They're quite intelligent. Okay, that is donkey. Okay, so we have a remedy from donkey, which is lacasina, which is donkey's milk, and they are actually known for, you know taking loads, and very, very useful animal. So like our patient said that I'm useful to them, that's why they're calling me. So yes, she is useful, and that's why I gave her this remedy, lacosinum 1M. I gave her one dose monthly for 2 months, and after that only saclac. And in first follow-up, which is after 1 month, she said she did not have the interest in studies, which has increased after first dose, and she's enjoying studying. Um, also started studying for public service sector. She is preparing for, UPSC, and wants to upgrade the job. She also told that the menses have come on time this month, which was delayed earlier. Overall 30-40% better within first month, which was very good follow. I continue. In second month, menses better, appetite better, no asthma attacks for last 2 months in 3 years. In 3 years, for 2 months, she could actually be on, or at home without going to hospitals. I'm so sorry. Little wheezing happened, and she had some allergy with pani puri, which is an Indian savory. So she said, I ate that in between. But it went off by inhaling plain water steam. She just had steam, no inhalers at all. Earlier, I used to take those medicinal puffs, so she was on steroidal puffs, which she stopped after my medication. No low feeling. She said, I don't feel depressed anymore. I'm quite energetic. Every month we were continuing the dose. After 4 months, no, after 5 months, overall much better. Asthma, not at all, no negative thoughts. She had suicidal thoughts also, which she did not tell me earlier. So no suicidal thoughts. Energy levels much better, and almost 70% better she was. After 6 months, no more depressive thoughts, no breathing issues, no puff required for 3-4 months, no breast pain. And she also had headaches, which were not there. She had migrainous headaches. So medicines were stopped um, within 6 months. And after 9 months, also, she was better with no complaints at all. So I can see one chat. Yes, lack assignment is a good remedy, just like working as. Absolutely, Dr. Ram. Absolutely correct. And Dr. Raksha, you are absolutely correct. It was lack assignment, feeling of being a victim, slave, servant, or burden. And yes, donkeys are called beasts of burden. They, pull off lot of burden of society, and still they are like, they are not valued that much, not appreciated enough. So that was our case. So it was a beautiful remedy which helped our patient. I will talk more about mammal themes at the end of the session, but let's go to the second case right now. I hope it is clear to everyone. If you have any questions, just drop in the chat box. I will address them at the end. Okay, case 2. So this case has complaints of PCOD with primary infertility complicated with diabetes. So three major problems. Again, a female with primary infertility, PCOD, and diabetes. Very complicated case this was, because she was a gynecologist. So it was a very challenging case for me, because when you treat allopaths, this becomes I mean, allopaths, homeopaths, whatever. When you treat doctors, it becomes challenging because they have a lot of knowledge and they have tried everything. So this becomes already complicated. But thankfully, it was a very nice case which solved with a beautiful mammal remedy. So this is Mrs. S. She was 29 years old when she came to me, married for 4 years, couldn't conceive, tried IVF two times, IUI 4, 5 times, nothing happened. Very stressed about baby. And when I saw her, I was just thinking in my mind that why she tried IVF 2 times and IUI 4, 5 times just in 4 years. But that you will understand slowly when you understand her nature. So diabetes since 3 years after marriage only she got to know that she had diabetes. Her random blood sugar was almost 280, 270, 260, something like that. Many cysts in the ovary, AMH is low, so again hard to conceive. She had migraines, history of migraines, terrible pain with heaviness, pain in the eyes, dysmenorrhea, and she used to take antispasmodics. Gets better, dullness over face, weakness, fear of snakes she had. These are all general symptoms. I'm just telling you the summary. And then she said, I'm very stressed about having a baby as family is creating a lot of pressure for child. Secondly, I also feel now that I should become a parent. I want my child. My husband is also having some expectations for what to do, doctor. Generally, I'm taking hypoglycemics thrice a day and still the sugar. So after taking, metformin and whatever medicine she was taking, 250 to 280 sugar, sometimes 300 also. And her obstetrician said that with diabetes, it is difficult to conceive. That's why you're not able to conceive. Lot of stress. In-laws compares me with the sister-in-law and Devrani that she is very fair. So the Devrani and Anand are very fair people. She is not that fair. So mother-in-law says your skin is dull. You're not able to produce the child and you're just useless. So she started weeping with this. She said, my mother-in-law always hurts me by abusing. She has this habit of abuse. She's very bad. And husband also accepts this. So husband was there only. And husband said, yes, this things happens. So I said, how does it feels to you? So she said, very, very insulting. See, in case it is very important that we know the perspective of patient. That's why we should ask their feeling, emotion, and experience in the situation. Because experience matters the most and not the situation. Okay, situation can be very small or very big, but their experience matters. Sometimes you will see that the situation is extremely crucial or important or bad, but patient's perspective is very positive. So you have to understand that. And sometimes the situation is whatever is the situation, patient's experience is extremely different from usual. So in this case, she said, I feel very insulting, doctor. My family is very educated, reputed family. Father is a collector, brother is a judge. I always had servants in my house. I have certain standards of living, but these guys are only concerned about looks, child. Standard of living is just zero. She compares me every day with the sister-in-law. She's nothing in front of me. But still, my mother-in-law doesn't understand this. I love to wear new clothes, new accessories, makeup, so my sister-in-law looks shit, but because she is fair, everyone feels she is beautiful. And except my mother-in-law, no one says that I don't look good. But I have observed because of all the stress, my skin has become dull. So she's concerned about dullness in the skin. A lot of cystic acne is also coming. I'm educated. We don't think all this. But these people have just given me all this shit. I was always a very ambitious girl. Since my college days, I was very ambitious. I wanted to be a bureaucrat. And somehow I couldn't go there, but I became a doctor. I did my PG. I came into, she's already in the, job and she's also a gynecologist. So she said, once I have given UPSC, got selected in mains, but then I dropped the idea of joining the job because I wanted to live with a family. That time I got married. So she was narrating her nature and she said, I left this job opportunity. I didn't go for the interview because I got married and started living with the husband. I thought, abhi nahi family banaungi to kab? When will I start my family? So I left the opportunity. Generally, I'm a caring person. I need my own space. I don't like interference by anyone. I live alone here and my husband is away. He's in another city. So husband is a orthopedic or some other doctor. I don't remember exactly. But so the husband is lives in some other city. I take care of my health, but still these things are happening. I go for walk. I don't do binge eating. All the precautions, diet, regimen, lifestyle, everything is good. I love my freedom. Don't tell me what to do. If someone tries to dominate me, I can't take that. My mother-in-law, she overpowers me. She treats me like a normal stereotypical daughter-in-law of Indian society. I don't want to do that. I saw madam, she compares me with these uneducated morons. I'm not like them. There is a huge difference between me and my sister-in-law. But see, my nature is like this only. Since childhood, my parents has allowed me to stay alone. I had my personal room. I never allowed even my mom or my sister to enter my room. That was my space. I want my own space, my freedom. But here, everybody is just intruding my space, coming into my room. My mother-in-law gives me advice day and night. She just gives me advice over phone. She intrudes my privacy. I don't like that at all. Also, I'm a cleanliness freak. I love clean house. Everything should be at proper place. I clean my house myself. I have servants, but I don't rely on them. At my workplace, also, I take special measures for hygiene. We are doctors, so we should understand. This is what she said. So I asked more about her childhood. So she said, like I told you now, I was the youngest sister in my siblings, but I never allowed them to enter my room. I was extremely fastidious. Nobody should touch my things. Also, I was active in badminton, tennis. I used to love sports, even football and chess. I used to play when I was in school. Overall, I was good in sports. I used to take part in relay races, running, jogging, and otherwise, in my childhood, I was very privileged child because my father was an elite person. So he has provided everything we wanted. I was a boss of my house. I used to, just tell them what to do, and they used to do it. As a child, I was very, very independent. I was not like other kids who will always need their parents. मेरे को चलता था. I was okay. I could survive on my own. So I was very independent, free, and my parents did not did not steal my freedom, did not interfere into that. I don't, so she doesn't like interference. So my observation about her was she's a very smart, ambitious, and a very strong person. She cannot take someone as boss. So that what is her main problem is that the mother-in-law is constantly giving her directions, what to do, what not to do, which she doesn't like. She cannot tolerate comparison, but she herself is very competitive. You can see that, okay, she was the youngest sibling as compared to others. She was the boss of the house. She's saying that I belong to a very elite class family, but my sister-in-law, she is not educated. I am educated, they are not. I am better, they are not. They are very, but in her own nature, she is competitive. That's why she is able to see this comparison. She needs her freedom and independence. Very important for her. Space is very important. Like she said, I want my own room, my space, my freedom. And very high sexuality, you can see. Loves makeup, bright clothes, all these things. This is a sign of sexuality. And very, very fastidious. She doesn't like unhygienic things, untidiness. She needs everything clean, neat, hygienic. So we needed a remedy which is independent, needs her own freedom, doesn't like interference at all, very competitive, and one who is highly sexual but neat of family and motherhood. Motherhood is very important theme of the remedy. And also it should have fastidiousness, as this is also very important for our patient. So we need a remedy which has, we saw that theme of competition is there. Me versus you again. Me versus mother-in-law. Me versus sister-in-law. Me and my husband. Me and family. This gives us animal theme. Okay. In animal also, she thinks about family. Family is very important for her. Motherhood is very important. I mean, imagine someone who has appeared for a UPSC mains is not appearing for a interview just because she got married. Isn't it strange? Because she said, "Abhi family nahi banaungi to kab? When will I start my family?" So need for family, need for motherhood, and this gave me the answer of my question that why she tried IVF 2 times and IUI 3-4 times in only 4 years of time. And she's young. I mean, only 29 years, not a 40 years old female. But still, that need for motherhood is very, very strong. So that's why we need mammal remedy. Because in mammals, you see very strong mother and child bond. So which family, which class we would need? There are so many subclasses in the mammals. So there is a class called Felidae, okay, or Felidae. Felidae means the cat family. So I have given her lac felinum, which is cat's milk, because cats are very, very independent. You might see that, if you have a dog as a pet and a cat as a pet, you will see certain difference. Dogs, you can pat them anytime, you can cuddle them, they will come to you, they'll be very loyal to you. Cats are also loyal, but they will come to you only if they want. They are very, very clean, neat, clean. You will, even if they are peeing or defecating, they would just hide that, come all the time, constantly. They are fastidious, they would clean themselves. They don't like unhygienic places at all. And very, very independent animal. So cats were the first animals which was, which was which was adopted as a pet, but still very, very independent animal. Not like dogs. Dogs you can pat, cats only if they want. So cats are very, very independent, free. So themes are competitive, very ambitious people. She is very ambitious. Okay, she became a doctor and still wanted to become an IS officer, which she left because of motherhood. Okay, so competitive, ambitious, likes company, but a small group. Space is a very important theme of, Felidae. So space is very important for her. Looks is important to her. So like she said, mother-in-law only, thinks about looks. She also looks at that because she needs makeup, nice clothing and all those things and accessories and everything. So looks is important to her as well. She's smart, jealous, opinionated. She has a strong opinion about everything. Authoritative. Can you see? She said, I was the boss of in the childhood. And I was, in childhood, everybody needs, most of the people are clingy to parents. She was not. She said, I could be on my own. She wants child badly. Own freedom is very important. Loves family, loves to talk, very open, loves makeup. So she, it gives us a hint about sexuality. She's very fond of clothes, makeup, very sporty. Can you say she used to play badminton, tennis, relay races, and whatnot? Very sporty and active. So the thrill of winning is there. She wanted to win. So she said, I used to participate in races and I used to win. I really felt nice. Cleanliness, tidiness, aggression is there. Cat is the only animal, like I said, that exercises its own rule. It can be a pet, but of her own choice. She lives in domestication on its own terms. It is the only animal which decides for itself that it can be patted or not. They harp about their independence, their need for freedom, and being able to make their own choice. Still, they have a feeling of being small and dependent. This lady is very free, very independent, still wants motherhood so badly. If she could have, she could have gone for this interview of UPSC in spite of being married. That is okay. But she did not go for it. If she would have gone, no, I would have given her some other big cat, like lion or something. So we have lac leoninum as well. But that's why I chose lac felinum and not leoninum, because it's not a big cat. Big cats are more ambitious, still have a tint of motherhood, but very, very ambitious. She is ambitious, but up to a certain extent. So cats have a small territory, not a very big territory. So her territory is her hospital, her family, that's all. So feeling of being small and dependent is there. They do not have great ambitions, just like big cats or tigers, but in their own small space they want their freedom. Mera room, my space, my work, that's all. Utna freedom they do, they are fine. Very much fond of cleanliness. You might have seen a lot of cute cats, licking all the time and cleaning themselves. So theme is trying to find own identity within the boundary of confinement. Clear views, clear choices. As a child, as an adult also, she has clear choice. I want this. Strong competitive people, independent with their strong opinion. They can be compared with row 3 and row 5 remedies like natrums, magnesiums, argentum, because they have, little bit of creativity as well. So these are all beautiful big cats. We have big, small, whatever. So it's a big group. So after 1 month, her mood was better. When she came to me, she was extremely angry, irritated, and a lot of problems. And when she was narrating, also she was taking homeopathy because that was the last resort, but she did not have much faith. But then after a month, menses became normal. Dysmenorrhea was not there. Her random blood sugar for the first time was 200 for entire month. So she checked almost every 3, 4, third, fourth day. And because she was very panicked about this blood sugar and she was taking this hypoglycemics, I prescribed her a intermediate intercurrent remedy, uranium nitricum, which reduces the sugar along with lacthalina. So I just gave 2 doses in between because she somehow put some pressure on me. So I gave that, and after 2 doses, her random blood sugar also reduced. Hypoglycemics also reduced. That became just once a day after 2 months. Overall, she was much better. 4 months later, she just called me and sent me a photo of her pregnancy kit. So pregnancy was positive. This was a case of 2019. So 22 June, we spoke over phone and she was almost 8 months pregnant. I treated her only for 4 months. I mean, actually for 3 months. And in third month only she conceived. Stopped the remedy within 5 months on 23rd July 2019. That's the lady, the mother-in-law actually, and this is the boy. So she delivered, and after 1 year also I had a follow-up. So she had no complaints after first dose, perfectly all right. Um, so my tips to prescribe these to patients who are very self-dependent and decisive as a child. So as a child, if you see dependency, don't pick up this remedy. They have to be, independent and decisive. Little children who have clear choices or who gives clear answers, they don't need parents. They don't look at mother like calcaria, no? That, okay, mama will give the answer. They would just give you right forward answers that, okay, doctor, I want this. I don't want this. I like chocolates. I like that. This is a great clue clinically to prescribe lactoferrinum. They are not talkative, but not shy also. I mean, very balanced. Need of space. Own space is very important issue. I have prescribed this remedy often in athletes with, great strong footwork. Artists also who are dancers with strong footworks. So these people are also receive lactoferrinum. The group mammals are like treasure box.
Yes,
I always say.
yes, the doctor only just 6 minutes remaining.
Yes,
How much time you require now?
sir. Just 2 minutes. 2, 3 minutes,
Okay,
I
okay,
will finish. Is that
okay,
okay?
continue. Okay, okay.
Yeah. So mammals are like a treasure box. So the themes are they need to have groups. For example, you can divide them in the vivacious group, loud, talkative, expressive. We need to prove all mammals. We have less mammals in the homeopathic materia medica which are true. But Kant said this that these can be treasures. We should prove milk is the beginning of life. So it is used in first year of life, and hence it can be really really useful. They know how to live in the group. We are also mammals. Black humanum is a great remedy. So, reason one can domesticate a mammal is they can form a bond with any party. They produce babies and they can live in the group. So, constant need for group is there. Need to belong is there. We have cats, bears, whales, bats. We have different types of aerial mammals, water mammals, land mammals, but all live in the group. You will see they have mother-child relationship. For the first few years, child lives with mother, so need to be liked by the group is very important. They are submissive to the group, need to take care of the group. Group is hurting them. So everything starts and ends with the group. They deal with all these issues. Who you are in the group, who dominates you, who submits to you, who you will submit, Identity, who identity would be an issue. You share, you talk, this is me, this is my position. So what is their position? Either they are somebody or anybody, or what exactly? This is their general issue. Mammals have good amount of self-esteem, security from the group which they get. That's why group is important. So this group could be a family or friends or anybody else. Feeling of being seen, being neglected. In first case also you have seen that being neglected was an issue. So being seen, being appreciated is very important. Desire to be heard, or they have feeling, why can't people listen? So need for appreciation, need for communication. So you see lachesis and tiger. Tiger is in mammal group, lachesis is in reptile group, which are, the king predators. But lachesis doesn't want to be seen. It will be hidden. Okay. So they have hidden feelings. All things are manipulative, but not mammals. They want to come open and, defeat you. So insects can be hidden. They are so close to humans. With mammals, you can see small goat, cow. They can't be hidden. They will not go unnoticed. Snake can go unnoticed. So this is a theme of being noticed and appreciated. So we have a lot of mammal remedies. So this is the whole keywords which we can use: society, clan, friend circle. And these are common remedies. You all know laccan, lactulinum, laciquinum, lacumanum, lacloxodonta, which is elephant's milk, prenum, and the theme independence, dependence, conflict is there. The relationships are very important for them. They live in the group, and that's why relations are very important for them. This is a very complex hierarchy. Care, nurture, love, strong maternal instinct. In both the cases, you will see, maternal instinct. In first case, the girl is taking care of the family like a mother. And in second case, she wants motherhood very strongly. Also guides and nurtures, because milk is nurturing element. Communication is also important theme of mammals. Living together, hunting together, courtship, share love, care, feelings through communication. Hierarchy, you will see. Territorialness, you will see. Home is an important theme over there. And need of parental care. So in first case, you saw that this lady, 28 years old girl, she lost the father. So she wanted that parental care, but now she's providing that. So many issues are interlinked, not simple like minerals. One issue and one problem is not there. Many things are, there. So mammals are like treasure box, and we need to prove all mammals. This is very, very important. So at the end, I just want to tell all of you that these group of remedies are extremely useful. Please use them and you will be surprised to see the results. Thank you so much for your patient listening. If you have any questions, just let me know.
Thank you, Dr. Yamini Remesh. It's really a very good session indeed.
Thank you.
And your depth in case taking, as well as depth in knowledge of homeopathic veterinary medical is something great, I must say. Because of that, you are able to choose such rare remedies in these cases, and all the cases presented here are so brilliant. And as a result of your prescription, the lady got pregnant, and in the last case, the child was born. You can take the credit for that. Of course, a homeopathy can take the credit also. Anyway, congratulations, and it's the time for discussion. And those who want to have a chat or want to have a question to Dr. Yamini, yes, I think as there is no time for that, we have another session coming here. So I invite Dr. Manoj to say a vote of thanks to the session.
Thank you, Dr. Dhanesh. As rightly mentioned by Dr. Dhanesh, a lot of reflections and brain work is involved in all these cases of prescription. It's not easy to contain this case of diabetes mellitus with ease. You did that. On behalf of IFPH, I am expressing sincere thanks to those, Dr. Yamini and all those participants in this English session. Thank you.
Tomorrow there will be there will be a session from Dr. Abhishek Banerjee an MDS holder, that's a dentist, and he will be talking about commonly encountered oral lesions and diagnosis. That's all about today. Congratulations, Dr. Yamini, and those who attended the session. We are thankful to all. With that, we come to the end of the day, 1475. Thank you all. It's over
Thank you,
to
sir.
Dr.
I'm so
Manoj.
grateful. Thank you.